Hi, today we're going to talk about hyperthyroidism. That's where we have too much activity from the thyroid gland. This is a lot less common than we have with hypothyroidism. Hypothyroidism is a lot bigger problem for individuals, but hyperthyroidism really on its own can cause a lot of very aggravating symptoms for people. When the thyroid gets upregulated, the symptoms that go with that is a lot of neurological agitation. Individuals can become nervous or very anxious. Many times the heart rate goes up very high to 120, 130. I've had a patient as high as 150 heart rate. Normally it should be around 70 or 80. Individuals, because of the increased rate of metabolism, will start losing weight. The same individual I mentioned a minute ago, he was weighing 185 pounds normally. He was down to 125 when I saw him. He had lost a tremendous amount of weight, and a lot of anxiety tends to go with that. When you have these high levels of thyroid, the thyroid gland is really putting out a lot of too excessive hormone for lots of different reasons. The medical control for this is usually some kind of medication and or sometimes surgery to remove a portion or all of the thyroid. Obviously we try to stay away from that. We like people to come in with the organs that they left with, so we try to work on what's causing the hyperthyroidism. So what causes hyperthyroidism is a little bit different story, and it's not the same for every individual. In some cases I've found that people have a chronic fatigue virus like an Epstein-Barr virus or herpes virus 6. Those viruses can actually get in the thyroid tissue, and the immune system, in an effort to try and handle those viruses, actually inadvertently start programming itself to start attacking your own thyroid tissue. The same is true for heavy metals. Heavy metals sometimes are the triggering factor to get the immune system attacking your own thyroid and causing the upregulated activity of the thyroid. As well. So heavy metals like mercury and lead and other kinds of metals are things that can be an aggravating factor and can be a triggering factor for hyperthyroidism. And sometimes it's a combination of any of those factors. We've even had bacteria from teeth issues be a stimulating factor, again, for the immune system, causing a hyperreaction of the thyroid. So, and of course, the thyroid is easy to evaluate and to see where the overall measurements are in terms of T3 and T4, and T4 is what's being produced when you have hyperthyroidism. So it's a very, and it's much easier to diagnose than hypothyroidism. It's much more direct, but the causative factors we have to be investigating to see what those things are.